Hey everyone, welcome back to the channel. If you've ever experienced itching, discomfort, or unusual discharge down there and wondered, could this be a yeast infection? You're not alone. Today we're breaking down how to know if you might have a yeast infection, what to look out for. So first, what exactly is a yeast infection? A yeast infection is caused by an overgrowth of a fungus called Candida that naturally lives in small amounts in your body. Normally, this fungus doesn't cause any problems, but when things get out of balance, like due to changes in hormones, stress, or even antibiotic use, that's when a yeast infection can develop. This happens most often in the vagina, but yeast infections can occur in other areas too, like the mouth, known as thrush, or on the skin. Now, how do you know if you actually have a yeast infection? Let's talk about the most common symptoms. 1. Intense itching and irritation. One of the first signs of a yeast infection is intense itching and irritation in and around the vaginal area. This itching can feel constant and might even get worse after wearing tight clothing or during activities like exercising. 2. Unusual discharge. Many people with a yeast infection notice changes in their vaginal discharge. Typically, the discharge becomes thick, white, and clumpy, often compared to cottage cheese. The good news is, it usually doesn't have a strong odor, but the texture and appearance can be a giveaway. 3. Redness and swelling. You may notice redness, swelling, and tenderness around the vulva. This can make the area feel sensitive to the touch and might even burn when you urinate or have sex. There are also some less common but possible symptoms of a yeast infection that you should be aware of. 4. Burning sensation. Some people experience a burning sensation during urination or sex, which can be really uncomfortable. This burning is usually a sign that the infection has caused some irritation to the vaginal lining. 5. Soreness. If you're dealing with an infection, the area might feel sore or painful. It could be tender to the touch, or you might feel a general discomfort when sitting or walking. 6. Cracking or cuts. In some cases, the skin around the vaginal opening can become cracked or develop tiny cuts. This usually happens when the itching is really bad and the skin becomes irritated. Now here's the tricky part. Some of these symptoms can overlap with other vaginal health issues like bacterial vaginosis or urinary tract infections. So how can you tell if it's actually a yeast infection? With bacterial vaginosis, you'll usually notice a fishy odor, and the discharge is more likely to be thin and grayish, whereas yeast infection discharge is thick and white. UTIs primarily cause painful urination, a burning sensation, and frequent urges to pee. But without the thick discharge or intense itching that's common with a yeast infection. If you're still not sure, or if your symptoms aren't improving, it's always a good idea to see a healthcare provider. They can do a simple test to confirm whether it's a yeast infection or something else. So what causes a yeast infection in the first place? Here are a few common triggers. 1. Antibiotics. Antibiotics kill off bad bacteria. But they can also kill the good bacteria that keep your vaginal flora balanced, making it easier for Candida to overgrow. 2. Hormonal changes. Pregnancy, menstruation, or hormonal birth control can throw off your body's natural balance, increasing your risk for a yeast infection. 3. High blood sugar. If you have diabetes, or your blood sugar levels are high, you're at a greater risk for yeast infections, since yeast thrives on sugar. 4. Tight or non-breathable clothing. Wearing tight synthetic underwear. or pants can trap moisture and heat, creating the perfect environment for yeast to grow. If you think you have a yeast infection, what can you do about it? 1. Over-the-counter antifungal treatments. You can find over-the-counter antifungal creams or suppositories that usually clear up a yeast infection within a few days. Popular brands include Monistat or Canesten. These are effective for mild to moderate yeast infections. 2. Prescription medications. If you're dealing with a more severe infection or recurring yeast infections, your doctor may prescribe an oral antifungal medication, like fluconazole. 3. Probiotics. Some people find that taking probiotics can help restore the balance of good bacteria in their body and reduce the chances of getting yeast infections in the future. It's important to know when to see a doctor. If this is your first time experiencing these symptoms, it's a good idea to get checked out to confirm that it's a yeast infection. You should also see a doctor if your symptoms don't improve after using an over-the-counter treatment. You keep getting yeast infections more than 4 times a year. You're pregnant or have a weakened immune system. You're unsure whether it's a yeast infection or something else. Let's quickly talk about prevention. How can you lower your chances of getting a yeast infection? 1. Wear breathable underwear. Choose cotton underwear and avoid tight, non-breathable clothing to keep moisture and heat away. 2. Avoid scented products. Stay away from scented soaps, douches, or sprays in the vaginal area, as these can disrupt the natural balance of bacteria. 3. Stay dry. After swimming or working out, change out of wet clothes as soon as possible to avoid creating a moist environment for yeast to grow. 4. Maintain balanced blood sugar. If you have diabetes, keep your blood sugar levels in check to reduce your risk.